What is shockwave therapy? So shockwave therapy is a non-invasive form of treating many musculoskeletal conditions effectively. How does it work? You've got a projectile and compressed air which hits that projectile against the tissues, literally converting kinetic energy into a pressure wave. Once this pressure wave hits into the tissue, it creates a little cavitation effect. And it's this cavitation effect that promotes the body's natural healing processes. So unlike a cortisone, which blocks the body's uptake of the chemical that causes pain, shockwave actually it reduces pain, but it also promotes the body's natural healing process. So how does shockwave help? It reduces the pain felt by nerve fibers by causing a release of substance P, which is the chemical that tells the brain there's pain, an exhaustion of the substance P, and underlying tissue healing so that there's less substance P being developed moving forward. It also increases blood flow into the area, which promotes tissue healing, as well as the beginning of the healing process by stimulating underlying stem cells, which are found within the body. So what does the shockwave treatment process look like? After your diagnosis has been confirmed and it's been decided that shockwave therapy is a suitable treatment for you, we'll look to do a session or a course of 3 to 5 sessions of shockwave therapy done a week apart. The reason for the break between treatments, or a couple of days off between treatments, is to allow for the body's natural healing process to occur. Most patients report a reduction in symptoms straight after the shockwave session, where they feel a little bit of a reduction in pain. However, this is a temporary process, and the actual healing process needs a couple of days to take place. So incrementally overall the tissue starts to heal and the condition starts to recover and you feel better, but this takes time. So that's why we have the treatment spaced a week apart. So what are the more common conditions we look to treat using shockwave therapy? Some of the more common things we see is shoulder pain. So if you've got subacromial pain as a result of an impingement, you've got tendonitis, calcific tendonitis, you've got tendinosis of some of the shoulders, tendons, they're starting to degenerate, achilles tendonitis, plantar fasciitis. We've had a lot of really good results over the years using shockwave with knee arthritis, treating chronic meniscal injuries. There are a large number of musculoskeletal conditions that we can treat with shockwave therapy. If you're not sure if yours is a suitable condition, please feel free to reach out and we can advise you whether it may be suited as long as there's no contraindications. We could look to use some shockwave therapy on it. Those people that have had cortisone injections or not looking to have another cortisone injection, often the conditions that would respond really well to cortisone will often also respond really well to shockwave therapy with better clinical outcomes in the long term. So research shows that shockwave therapy is both a safe and effective treatment modality. It's non-invasive. It doesn't penetrate into the skin or penetrate through the skin into the tissues. So it's a completely external therapy. Obviously, there may be some side effect because it is a pressure-related therapy. So there may be some side effects that could include a little bit of redness in the area. Post-treatment could be a little bit of bruising in the area. So some of the things we look out for is the patient on blood thinning medication like anticoagulants, or do they have a bleeding or clotting disorder? We obviously would look to not use shockwave in that instance. We don't use shockwave on pregnant ladies, as well as anyone who has an active tumor or infection in and around that site. We don't want to look to increase blood flow if there's an underlying infection. And the last thing is if you've had a cortisone within the last 6 weeks, because both of those work off substance P, and the way in which shockwave and cortisone work is a little different. So if you've had a recent cortisone, we won't look to start shockwave therapy for 6 weeks after the cortisone injection.